Hello everyone, this is Dr. Sahitya Bammidi, Consultant Obstetrician Gynaecologist, KIMS Hospitals, Gachibowli. Today I am going to talk about the topic called as Post Menopausal Bleeding. So what is menopause? Complete cessation of the menstruation for 1 year, we call it as a menopause. So after the menopause, if the women complains of bleeding, we call it as a postmenopausal bleeding. There can be multiple reasons for the postmenopausal bleeding. Usually, Indian women can have menopause from 45 years to 52 years. So the women age group can range from 45 years to 52 years. In menopause, mainly what happens is complete body hormones, like the women hormones will go into very lesser level, and that can lead to many kind of symptoms. So after the menopause, if the women complains of bleeding, that is an abnormal symptom and that has to get evaluated. Sometimes this postmenopausal bleeding can be the first symptom for an uterine cancer, because 10% of women complaining of postmenopausal bleeding can have uterine cancer. So the other reasons for the postmenopausal bleeding can be hormone replacement therapy, or the uterine lining can be very thick, and sometimes the growths in the uterus like polyps or uterine polyp or uterine fibroid can also lead to the postmenopausal bleeding, and the opening of the uterus called as the cervix having the cervical polyps or cervical growth or cervical cancer can also present with postmenopausal bleeding. So if any women who are after cessation of the menstruation of complete 1 year, if they are having postmenopausal bleeding, that has to be get evaluated immediately, and they have to meet their gynecologist as early as possible. Thank you.